Welcome to the Platinum Planner Preceptor Training Program. This is Chapter 1, dealing with your role as the preceptor. So as a preceptor, which is one of the key critical parts of the educational process for our students, it basically takes them from the laboratory classroom experience and transitions them more into the actual role of an EMS provider. So as a preceptor, that key role then has some specific characteristics we're going to talk about, responsibilities that you'll have, and in particular the three most important responsibilities that you as a preceptor have. Your role, again, you are a key link between that classroom and that lab experience. So basically we take the classroom and the lab, so the didactic and the psychomotor aspects of the program, and tie it in with the affective aspects, especially dealing with our patients. Our key role is to safely, emphasize the word safely, guide that student into that risky world with the real patient. Certainly in the classroom and in the lab, we kill a tremendous number of simulated patients. And what's really awesome is they can come right back to life again. But we all know in the real world, that's not the case. And so we need to have that student recognize that though it was easy to undo something in the classroom and lab setting, it is not so easy to do in the clinical setting. We also need to show how all of those things that they have learned in the classroom and in the lab do apply in the real world setting. And so that's our role as a preceptor. So characteristics of that preceptor are integrity and honesty, empathy and compassion, being self-motivated, and professional experience, good hygiene, basically an awesome role model. Self-confident and clear in our verbal and written communications. As we can see from this list, basically it's the things we would want from a professional. A lot of our teaching as a preceptor doesn't involve just going over the skills and making sure they can do the skills properly or understand the medicine, but also what is it we expect from a professional EMS provider. And you are their first experience in that person in a real-life setting or in the hospital setting. You're that person who shows them, here's how we interact, here's how we care for our patients, or any other clinical setting. Again, continuing on, effective time management skills. It's not good for the preceptor to show up 5 minutes after the shift is supposed to begin, especially if the student shows up 5 minutes before the shift is supposed to begin. We need to be diplomatic and respectful. You need to be knowledgeable on the material. The students are going to ask you questions that you might not know the answer to, and that's okay. But what we don't want to do is to say to the student, well, you don't need to know that, because obviously if they've asked the question, then they have a desire to know it. And then what we can do is both research it together. You also need to be highly skilled to the point where you can be doing your task and still able to keep an eye on the student to make sure they're not doing anything bad. And then finally, in our characteristics, we need to be a student and a patient advocate. We are there for those two people, and we need to make sure neither of them get injured. So as we keep going then on our responsibilities of the preceptor, we need to keep the patient safe from harm. These students, though well-intentioned, are oftentimes a klutz or will do things not intentionally meaning to hurt anyone, but could in fact cause severe harm. So we want to keep an eye on that student and make sure that patient doesn't suffer from their interaction with the student. We also need to keep the student and the crew safe from harm as well. Again, students will do the unexpected thing, so we need to be on our toes to catch any of those challenges. And then finally, we need to keep the environment safe, where the student can practice on actual patients and actually get the clinical experience they need, but again, where no one is put at risk or in harm's way. So as you take a look at the top three responsibilities of the preceptor, they all deal with the safety of the patient, the crew, and the environment. Continuing on our responsibilities, trust but verify. Hey student, you said you wanted to do an IV. Talk to me about the procedures of starting an IV. And then listen, and they may tell you something that isn't quite accurate. It's your responsibility to make sure a student can do something before they try it on a patient. Paperwork, 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 or document, document, document. We know it in our jobs. It's no different in the preceptor world. We need to clearly communicate with all involved. We need to tell the patient, hi, this is a student with such and such program. They're going to be starting an IV on you today. Is that okay? We need to communicate with our staff and or our crew that, hi, we've got a student ride along today. Any questions, any concerns before we begin? Introduce folks back and forth. Let everybody know what everybody's role is. Watch that student, and if they do something wrong, we need to feel comfortable saying, hi, the technique you use there isn't normally used, or we're not aware or familiar with that. Have you considered this type of technique? And again, safe, constructive, and timely feedback. So it needs to be delivered in a positive fashion so that when done, the student feels good about what's occurred. Correlation of the pathophysiology and the actual patient. So often students in the classroom setting don't get, why do I need to know this? When am I ever going to need this? But if that patient has that disease and that pathophysiology then is presented to that student in a real life setting, then that'll help reinforce the material learned in the classroom and vice versa. It also might be that a student may find a piece of equipment that they've never seen. It could be a type of traction splint they've never had in the classroom setting, or a type of blood pressure acquiring device, like an automated blood pressure device where all they've ever used is the manual. And then we as a preceptor need to always be familiar with what are the school's policies and procedures and make sure that we adhere to those and be up on what the latest the school requires. So kind of in summary then, that preceptor, a key role in the educational process. You are a role model to these students. They're the ones that when you show up, or when they show up and see you, this is what they want to be. This is what they're training to be. They want to get into the world of medicine. They want to get into the world of EMS. You're their role model. So again, successful preceptor, your characteristics, basically all the things that you would expect out of a professional. Skilled, knowledgeable, caring, compassionate. So you basically are a master at all three of the domains of learning. Your responsibilities, your top three: keep the patient from harm, keep the student from harm, keep the environment safe to allow the student to practice in a safe manner. And then along with task of all the other things involved with basically being responsible for a student on an area where things may not necessarily be safe. This concludes Chapter 1. Thank you.